In the third and the final section of our lecture topic, adenoidectomy, we will discuss about very important topic, which is the post-operative care or post-adenoidectomy care. In this, we will talk about, besides the post-operative care or post-adenoidectomy care, we will also discuss about the complications that can occur as a result of adenoidectomy. So post-operative care, and before starting with the post-operative care, let's quickly summarize. We have adenoidectomy is the removal of the adenoid tissue, and adenoid tissue is like the tonsil, is the lymphatic tissue which is present on the upper part of the throat behind the nasal cavity. So by the location of adenoids, we can tell if there is any hypertrophy, enlargement of the adenoids as a result of infections or as a result of adenoidal hypertrophy. Most important complication that can occur is the obstruction to the breathing, and that needs to be treated on emergency basis if other treatment options are not effective, or patients who are getting the infections frequently, they have health problems, health issues, they need to go for the adenoidectomy. So we have some indications, and then remember this adenoid tissue, which is a lymphatic tissue, it shrinks or regress after 5 years of the age, because by that age we have some other lymphatic organs performing the functions of preventing against different infections and different microorganisms. So very important indication for adenoidectomy is the hypertrophy of the adenoids. And then we have recurrent infections, otitis media, discharge from the ear, obstruction of the eustachian tube. So these are all some indications of the adenoidectomy. We have some contraindications also, and the most common contraindication is cleft palate. That can be a contraindication. Patients who have bleeding diathesis, they can be, adenoidectomy should be avoided, because in that case the risk of procedure can be more as compared to the benefits, because adenoids anyway will regress after 5 years of the age. By that time, if we leave adenoids, they will regress naturally, or they shrink normally. So we have some contraindications of adenoidectomy also. The anesthesia is usually the general anesthesia that is used. Then we have position is the supine position with the neck extended and supported by the cushion, and then we should avoid the hyperextension of the neck that can cause the cervical spine injury. And then the procedure that can be used, we have adenoidectomy, simple adenoidectomy from the oral cavity, or we can do the same procedure with the help of the endoscope. So both can be used. And then anesthesia is general anesthesia. After the procedure, there is raw area left behind. So most important part is controlling the bleeding. If patient has a history of more bleeding, or they are more bleeders, the post-nasal packs are used for 24 hours, and if the both tonsillectomy and adenoidectomy is performed at the same time, which is the usual procedure, mostly they are performed at the same time. So the adenoids are removed first and then we remove the tonsils. So adenoidectomy is first, then the tonsillectomy. Now after that, all summarizing what we did so far, now the important is post-operative care of the patient with adenoidectomy. So it's the same as tonsillectomy. Make sure turn the patient to the comma position on the left side. So any blood that can occur, any aspiration should be avoided because that can cause complications. So the treatment or the post-operative care is the same as in tonsillectomy. There is no dysphagia, no difficulty in swallowing after the procedure. Patient is up and about early, so the patient are usually discharged on the same day, and they are mobile fast because it's not a very major operation procedure. Again, the post-operative care that should be paid attention to is immediate general care of the patient is important. Diet is important. The soft diet should be given. Usually in the beginning, the chewing on the ice is or swallowing the ice is recommended. Ice cream is very effective. All these cold foods or substances, they can cause control the bleeding and they can cause hemostasis. So it's very important, the diet. Oral hygiene is again important because it can start really smelling bad because of the procedure performed and because of all the blood. So oral hygiene is important. Analgesics for any pain. So analgesics are recommended on as needed basis. So if we need analgesics or painkillers, we should use them. Otherwise, usually it's not, the pain is usually bearable and it's not too much. Antibiotics are given to prevent any infection that can occur. So that's also the part of the post-operative care. Complications, the first and the most common complication of adenoidectomy is the haemorrhage that can occur. Usually seen in immediate post-operative period, so it's immediate period after the surgery or adenoidectomy. Haemorrhage can be present, and this haemorrhage bleeding usually from the raw area from where the adenoids are removed, the haemorrhage can occur, which is the primary haemorrhage or primary bleeding immediately after the procedure. Nose and mouth full of blood. So if you see nose and mouth full of blood, it means there is a major haemorrhage. Or only vomitus of dark colored blood. Vomitus of dark colored blood is very, very common. Usually the patient have the sore throat, the area is sore, they have pain, and there is vomitus of dark colored blood. Rising pulse rate, tachycardia is also present as a result of bleeding and haemorrhage. Tachycardia is present. Treatment of haemorrhage, same as for pre-operative hemorrhage. Post-nasal pack under general anesthesia. With that much bleeding, usually it's very hard to see behind the bleeding, so patients should be given general anesthesia. All the cleaning should be done, and then post-nasal packs are applied for about 24 hours. That's very important to control the bleeding because a lot of bleeding can cause decrease hemoglobin level, and then decrease more complications like anemia, shortness of breath. So primary severe hemorrhage needs to be managed properly under general anesthesia, and post-nasal packs are applied. Injury to eustachian tube opening, as I mentioned during the procedure, it's very important that the opening nasopharyngeal end of the eustachian tube, which lies very close to the adenoid tissue, needs to be protected during the procedure, and injury should be avoided. Here, if you see, that's the eustachian tube. That's the nasopharynx from the middle ear to the nasopharynx, and it's very, very close to the adenoids, and it needs to be protected. Injury to pharyngeal musculature and the vertebrae. Here again, this is the superficial cervical vein. We have cervical vein, then we have nerves also, vein, nerves, muscles, sternocleidomastoid, that's the muscle, that's the external jugular vein. Then we have greater auricular nerve. These are all the structures very close in the vicinity where the procedure is performed. So injury to the pharyngeal muscles and vertebrae can occur. Hyperextension of the neck should be avoided. It can cause the injury to the pharyngeal musculature and to the vertebrae. Undue pressure of curate should be avoided during the removal of the adenoids. Very, very softly and gently the procedure should be performed. Care should be taken when operating patient of Down syndrome. 10 to 20% of them have atlantoaxial instability. Patient with Down syndrome, they have atlantoaxial instability, so they need to be handled carefully, and undue pressure or too much pressure of curate should be avoided. An X-ray neck in extension and flexion should be performed. Then we have Grisel syndrome. Patient complain of neck pain and develop torticollis due to spasm of paraspinal muscle. So due to spasm of paraspinal muscle, due to extension, usually patient complain of neck pain, develop torticollis due to spasm of the paraspinal muscle. This is known as the Grisel syndrome. Atlantoaxial dislocation requiring cervical collar and even traction. So patient who can develop atlantoaxial dislocation as a result of hyperextension, usually they need the cervical collar to give support to the cervical vertebrae, and they even need traction, pulling of the vertebrae to bring them in their proper position because they are dislocated. Then we have velopharyngeal insufficiency. This is the normal speech resonates through mouth, and this is the patient with the velopharyngeal insufficiency, and they resonate through the nose. Patient with velopharyngeal insufficiency, they has nasal twang to the voice. So check for submucous cleft palate by inspection and palpation. And if you remember, that's one contraindication for the procedure. So always look for any submucous cleft palate by inspection and palpation before adenoidectomy needs to be performed. Nasopharyngeal stenosis, narrowing of the nasopharynx, occurs due to scarring. So after the procedure, if there is scarring during the healing, then it can cause stenosis or narrowing of the nasopharynx. Recurrence of adenoidectomy, remember regrowth of adenoid tissue, as we were talking about the procedure for the removal of the adenoid. I mentioned that we need to remove all the masses that are present in the lateral part or any small masses around with the punch forceps, because these masses which are left behind of the adenoid tissue, you can see they have the ability to regrow, and they can cause recurrence of adenoid hypertrophy, and again they need to go for adenoidectomy. So it's very important that once the procedure is being performed and patient is going through all that procedure, and besides that, even though it's not a very big major operation, but it's giving general anesthesia itself is a major can lead to complications and needs to be avoided. So it's better to remove all the adenoid tissue that is present, all the masses which are present, all the smaller tissue that is present, so we can avoid this recurrence of adenoids hypertrophy. So that concludes our topic of adenoidectomy. Thank you for watching sqadia.com.